Hi, today I thought I'd talk about medical needling following my recent Instagram post asking for questions, and the topic kept coming up, and I think it's been asked before. So my take on medical needling is that it's one of the most useful and certainly one of the most performed treatments I do in the clinic. A specific question was asked: what is best for treating from an anti-aging perspective for the first signs of aging, so fine lines and wrinkles, but someone who's also tackling acne scarring, what would my recommendation be? And the answer would be medical needling. I think works well for both. Now, just to make the distinction, when we talk about medical needling, we're talking about a treatment that's done in the clinic, so in a clinical sort of setting, because it needs to be done under sort of sterile conditions. So when we talk about medical needling, what we're doing is using the impact of a needle on the skin and actually needling down to the level of the dermis to trigger a series of events which mimic the natural skin repair cycle. So what happens is you are causing micro bleeds in the upper part of the dermis when you needle the skin. And this releases growth factors because you're damaging platelets. But the good part about needling is you're also preserving barrier function. So it means that it's actually safe as a procedure in terms of being low risk of infection, and also it tends to be very safe in skin with pigment, which can be more troubled by complications like pigmentation afterwards in other types of treatments like lasers. So I like needling because it suits almost every skin type for those reasons. So triggering a dermal reaction to ultimately lay down collagen, and it's also known as collagen induction therapy. And yeah, it tends to be a treatment that has relatively little downtime for the yield that it delivers. I would say that for most patients, a weekend of looking red and sunburnt tends to be the height of it. It's something that I'm personally quite comfortable doing even on a kind of a weekday, because I know that a little bit of makeup will cover up the redness the next day. So it's a treatment that is easy to fit into a busy person's life, where some more aggressive treatments can literally take you out of circulation for 7, even 14 days, which I find to be just not that practical for many of the women that I see in clinic. So it's convenient. It gets to the dermis, which is where we want to really trigger regeneration, because that's what's going to give us great anti-aging benefits. It's also going to be what's going to help with acne scarring, where again you've got an injury that leads to an indentation in the skin, and by laying down new collagen you tend to lift up those indentations. Typically best affected are rolling scars, which are sort of saucer-shaped indentations on the surface. But it also improves skin elasticity. It does tend to have a firming effect on sagging skin, and I definitely see improvement in pore clarity. So those are the benefits with medical needling. The fact that it's, as I say, a versatile treatment that can be used in most skin types. It has relatively little downtime, and because it preserves barrier function, tends to be fairly safe. And I think it works best in the setting of someone who's on a medicated skincare regime, using proper sunscreen and skin essential ingredients like vitamin A and vitamin C. And I tend to have patients on those sorts of skincare essentials for at least 6 weeks before treating. So that's a very brief overview of the benefits of medical needling, and specifically to answer the question about anti-aging and acne scarring treatment in one, I think medical needling is a great fit. Please leave your questions down below and look forward to seeing you next time.